Hello, everyone. Thank you so much for joining us today for this live Google Plus Hangout. My name is Diane Fender, and I'm the Vice President for Girls Globe. We are a global network of young people and organizations who are raising awareness about the rights, health, and empowerment of women and girls around the world. We have an exciting treat for you today, and that we're talking today to youth about the importance of maternal, child, and adolescent health. It is estimated that there are more resources needed to prevent maternal and child deaths, and also to improve the health of adolescents around the world. So today we're going to be talking to young people and hear their perspectives and opinions on these issues. As the world approaches the 2015 deadlines for the Millennium Development Goals, we've seen enormous progress for women and children and adolescents. But despite the progress, there's still more that needs to be done to improve health for women, children, and adolescents around the world. The Global Financing Facility in support of Every Woman, Every Child aims to contribute to the global efforts to end preventable maternal, newborn, child, and adolescent deaths, and to improve the health and quality of life for women and adolescents and children around the world. The Partnership for Maternal, Newborn, and Child Health is coordinating consultations around the world to discuss the idea of a global financing facility that would really improve and scale up services for women and children and adolescents around the world. They're rallying stakeholders, including youth, to really be in this fight. And so it's such a privilege today to be here talking with youth. At Girls Globe, we believe youth voices are vital to this global conversation. Young people really have an enormous opportunity to affect change for women and children and adolescents around the world. So during this Hangout, we really want it to be interactive and participatory. You can tweet your questions to @GirlsGlobe using commit2deliver hashtag. And you can also ask questions in the Google Hangout box as well. So during this Hangout, we'll be taking your questions live. So make sure to tweet your questions and ask away. For me, I'm personally an advocate for women and children and adolescent health because I've seen the difference that access to quality healthcare services can make in the life of a woman and a child, not only here in the United States, but around the world. Today we're joined by several people, my colleague Elizabeth Epstein, and also several youth advocates, but I want to give them an opportunity to introduce themselves. So Elizabeth, if you can introduce yourself.
There we go. Okay, sorry. My name's Elizabeth Epstein, and I am the social media director for Girls Globe. I am currently based in Baltimore, Maryland, and I've been working with Girls Globe for about 2 years now. And I'm really passionate about advocating for maternal and child health because I think women and girls especially are so important to making progress with the Millennium Development Goals and the post-2015 agenda. And if you leave out, they're half the population, so if you leave out half the population, you can't really move forward in attaining these goals. So yeah, and especially, yeah, it's especially important to include them and to hear the youth voices, as Diane had mentioned before. We need to have our say, and it can't just be older, established political leaders saying what we need. So yeah, so that's me.
Thanks, Elizabeth. Fellow Jean, if you want to go ahead and introduce yourself, tell us about yourself and just briefly explain why you are an advocate for maternal, child, and adolescent health.
Okay, so thank you. My name is Fellow Jean Anumo. I am currently the Advocacy Program Associate at the African Women's Development and Communication Network, popularly known as FEMNET. And FEMNET is a Pan-African organization working to advance women's rights and to amplify African women's voices. And it was established in 1988, so we are celebrating over 25 years. Personally, I am an advocate and passionate supporter of promoting child, adolescent, and maternal health. One, because I feel I have gone through the whole cycle of reproductive, maternal, newborn, adolescent, and child health, and perhaps not exactly in that order. But I have a little baby. She's 1 year and 2 months right now. And growing up in a developing country, I've been able to see the importance of giving women rights and enabling them to get empowered to access their health, because this is the key that we actually need in the post-2015 development agenda to unlock intergenerational poverty. So that's why I'm a passionate advocate for this thing.
Thank you so much, Felogene, for joining us. And you're joining us today from Kenya.
Yes.
Samuel, if you would like to go ahead and introduce yourself and just explain why you're a passionate advocate.
Hello, my name is Samuel Kisi, and I am from Ghana. I am based in Accra, and I am an independent youth consultant, but I also work with a children and youth organization called Curious Minds. And as our name suggests, we are very curious about finding answers to all the challenges that we are faced with as young people and as children. We work mainly on issues related to children's rights and youth sexual and reproductive health and rights. As an organization, we are also part of a regional SRH network called AFRIAN, which stands for the African Regional Youth and Adolescents Network on Population and Development. I joined Curious Minds when I was 14 years old, and was mainly working on children's rights issues then, because we thought that it was important to get our voices heard as children. How I got involved in issues directly related to maternal health was through that initial exposure that I got in Curious Minds, but also because of certain experiences that I had. As a young boy, there was this woman just around the corner of my house who I'd see every day on my way to school. I never knew her name, but she always had a smile, and I'd greet her on my way to school and on my way back. And I found out one day that she went to deliver and didn't make it back home because there were complications during her delivery and she lost her life. And that and many other such examples made me start thinking I could no longer just sit on this the sidewalk and look, that I had to get in there and contribute in whatever way I can. So she and many others that I've known about have been my inspiration for wanting to contribute in whatever way I can. And so far I've been doing that mostly working with governments at policy level, trying to ensure that we make those changes that are so critically needed to ensure that no woman dies through childbirth, that women have access to all the information and services they need, but also for children to have a healthy life. So that has been my main inspiration, and that's why I'm here with you today.
Wow, thank you so much for those great introductions. We're so excited to just talk more with both of you today and hear your perspectives and opinions. My first question and item of discussion is based on a new global strategy has been proposed for women and children and adolescent health. In framing a post-2015 strategy for women, children, and adolescents, what do you believe are key interventions to be included, and why do you think that those interventions are important? Felogene, we can go ahead and maybe start with you.
So for me, at the top of the priority for policymakers and the decision makers would be ensuring universal access to all kinds of services that are around sexual and reproductive health and rights. This is especially because we see a lot of barriers to accessing these services, and these go across board. So for example, social barriers, where because of the kind of culture that we have, for example, in Africa, one is shy or is not able to access certain services because of the discrimination they are going to face. Secondly, are legal barriers. We know that some of the countries in Africa still to date do not have any law that actually encourages women to access safe abortion, even when the mother's life is in danger. And I think this is one deaths that are caused by unsafe abortions are highest among adolescents and young girls and women. And I think it's high time that we address this tragedy. And one of the ways is to have legal barriers removed that can ensure that women and girls that are able to access this kind of services. And lastly, which I think is a great initiative by the Global Financing Facility, is the financial limitation and the financial barriers. Access to services can be very expensive in Africa, not only limited to accessing the services themselves, but also the infrastructure that can allow you to get the services. So, for example, the roads, the human resources that are available, the systems that allow women and children to be recorded, because we know that what is not accounted for cannot be valued. So these are some of the things that we request the policymakers looking onward and looking at the post-2015 development agenda to ensure that there's universal access for sexual and reproductive health and rights, especially on reproductive, maternal, newborn, and adolescent and child health issues. So for me, that's one of the priorities. So perhaps Samuel can also top up, and I can give some more examples after he's spoken.
Thank you so much, fellow Jane. I know that is an area that you're very passionate about, and so it's great to hear your perspective and wanting to see that really prioritized in the post-2015 agenda. Samuel, do you want to chime in?
Definitely. So thanks for highlighting the issues, particularly as they relate to women, fellow Jane. Just to add on that, I think for me the most important thing to do right now is to have that first acknowledgement that this is an issue of rights and of women's rights and of children's rights. It is important to focus on this because when you hear all the different discussions going on, we tend to get bogged down in details and on different ideologies. But if we can come to an agreement that it is the right of every woman to have the highest standard of health, we have this even in the Convention on the Rights of the Child to say that all children should have access to the highest standard of health attainable. Why can't we agree that this should be the same for women, that this should be the same for everyone? So we need to approach this new development framework from a rights-based perspective, ensuring that we are addressing the issues that matter most. If we can agree on that, then we know that it is an infringement on a woman's right if, for instance, we are not making the right investments in healthcare so that women can have access to all the information and services that they need right now in order to have a healthy life. Second, I think we need to move away from just siloed interventions and address things from a comprehensive perspective. Look at all the different factors that come into play when we're talking about women's health, when we're talking about children's health, when we're talking about the issue of infants. Look at it from a comprehensive point of view so that we are bringing on board all the different interventions that we need, taking cognizance of the different contexts in which women and children find themselves, so that we are able to address all the different pull and push factors that end up having an effect on them. Now, if you take a small example of something like HIV and AIDS, the statistics available show that for all age groups, there's currently about a 40% reduction in AIDS-related death, except for those between the ages of 10 and 19. So this, for instance, is a clear indication of some of the gaps, the glaring gaps that we are having because we are not making the right investments, because we do not have enough funding, but we do not even have data on these age groups. And it is because we haven't really prioritized them as we should. So the issue of political commitment cuts across. But I think of all, we need to ensure that we are addressing these issues from a rights-based perspective, that we are making the right investments that trickle down from the global through to country level, so that when each government releases their national budget or when they come up with their country development plan, we can track how much is going to address the issue not only of sexual and reproductive health for all, but particularly for women, adolescents, and children.
Thank you so much, Samuel, for those key insights. And I think you made several key points, and that is really investing and really listening to women, children, and adolescents to hear what they need, and using that to really inform not only programs but investments that are made into programs starting at the global level and trickling down all the way to a grassroots level, so that meeting those needs of women and children and adolescents is a key priority. So the Global Financing Facility, I know both of you all are well understood and versed on the topic, but for those listening in, I just want to recap the 5 main objectives of the Global Financing Facility. One would be to finance national RMNCAH scale-up plans and to be able to measure results. 2 would be to support countries, specifically high-burden countries, in the transition towards sustaining domestic financing for RMNCAH. And then 3rd, to finance the strengthening of civil registration and statistics systems. 4th is to finance the development and deployment of global public goods that are essential for scaling up. And 5 is to contribute to a better coordinated and streamlined system and financing system for specifically for reproductive, maternal, newborn, child, adolescent health. So with these objectives in mind, and with your backgrounds and history in advocating for these issues, what do you think are critical use-related interventions that the Global Financing Facility, or GFF, should finance both within and outside of the health sector to improve specifically maternal, newborn, and child and adolescent health? Samuel, I think we'll go to you first on this question, and then to fellow Jean.
Hello, can you hear me? Yes, thank you very much. Sorry, can you hear me?
Yes, we can hear you.
So I think that there are a lot of things that we can do, particularly with young people in response to this, in terms of the interventions that we can use to ensure that this becomes a success. The first of it will be leadership of young people themselves, supporting young people's leadership, and ensuring that they are active participants in all aspects of the various initiatives that we are seeking to roll out. I think that is extremely important, and we talk about it all the time, but it is an issue that we need to keep focusing on, because we have not quite seen this support in order to have effective youth leadership. So providing capacity building, but also engaging with young people in a meaningful way, so that the interventions that are put in place address their needs, but also use them to reach others in many places, especially in the developing world, in order to really make a headway in reaching, for instance, women in rural areas. Sometimes you need the involvement of young people. So I think that is extremely important. We also need to work with broad networks of young people and ensure that they are able to help come along with innovative approaches of doing things, and cutting the bureaucracies that have usually stood in the way of the active engagement of young people. I think also that I just read something recently that stuck with me, that was saying that every system is perfectly designed to produce the results that it produces. And I think up until now, if you think about it, we have developed a system that perfectly ensures that young people's voices are not highlighted, that perfectly ensures the exclusion of different groups of young people, addressing them as a homogeneous group and not paying attention to the diversities that exist among young people, even within countries. So I think that we need true engagement on a whole new level, not thinking in a way of modifying in some smooth or linear, some minor way, the system that we've worked with, but really thinking in different ways that we can do this. And that, I think, will only be able to do if we are engaging young people in a meaningful way and providing the opportunity and the platform for them to make their own contribution. I would let Philogene add on, and then if need be, I'll come back.
Great. Samuel, thank you so much. I love one key point that, or I love all the points, but I love a key point that you said of we really need to reframe the system of conversation to where youth are included at all levels of decision making. So I think that's really such a great point. Philogene, do you have something to add as well?
Yes, thank you, Samuel. I think you've set a very good tone for this discussion. Of course, saying that leadership of young people is key and should be at the top of the agenda. But then increasingly what we are seeing are some of the not very popular topics that I feel that the GFF should focus on, especially since they are youth-related interventions. Key among this is ending all forms of violence and discrimination against women and girls. And I think of priority and what is gaining momentum across the continent and across the world is ending harmful practices such as FGM and child marriage, because we also know that this compounds the maternal mortality rates in Africa and in Asia, which is recorded the highest. So if this can be prioritized as an intervention and ensuring that something like child marriage should end in this generation and should not be something that will be talked about among future generations. Secondly is the issue of literacy. Like Kisi has rightfully put that we must have a rights-based approach to everything that we do. But literacy is very key in understanding what rights are. As we continually do this work, we realize that both policymakers and also us as custodians of this need to have a rights-based conversation. And this can only happen through education and lifelong learning. In terms of the youth-related intervention therein, it would be CSE, which is Comprehensive Sexuality Education. This will help young people make informed decisions. Whether the services are available for young people and the success therein will depend on whether young people are educated enough to make these kind of choices that will help save their lives when they are young and also prevent the high maternal mortality rates that we are seeing. Lastly is the issue of course, empowering young people economically. And this needs to be done for youth both in school and out of school. And the importance of empowering young people economically is that you bring up a society that is able to make informed decisions but also has the right resources to access these services that you're making available. The issue of unpaid care work that burdens mainly young women and girls must be recognized, must be reduced, and must be redistributed by the country. I think for me those are the three other interventions that need to be focused on by the GFF that are outside the health realm, but will also have a very high impact on achieving some of the objectives that are set out to do.
If I may add on, I'm very happy that you mentioned the issue of comprehensive sexuality education, Philogene, and when you speak to various young people from across countries, this is something that is critically needed, and it's so frustrating to see that we are still not at the point where we can have we've had consensus on this. And I am glad to see that even within the new discussions around the Sustainable Development Framework, that these elements keep coming out, and I hope that it becomes a strong part of this. But linked to that is the issue also of services, providing services that are youth-friendly. And again, if anyone has been involved in this line of work for even the last decade, provision of youth-friendly services is something that we keep hearing over and over, but we are still having to talk about it because we are not where we are yet. So I think that that has to be a very strong component, because if you have sexuality education and it is not linked to services, then that becomes a big problem. in many places where they allow some kind of sexuality education, people are even forbidden about demonstrating something like the use of a condom, for instance. So I think that that has to be important. Also, and this is just a personal thing that I've been thinking about, if we really want to look into the future and look beyond some of the immediate challenges we are having, we need to find ways of reaching young people with comprehensive sexuality education, with referrals to services. If young people can have access to pornography on their phones, why can we not have a system where they will have access to comprehensive education around issues of sexuality, say by downloading it from the Android store or the Apple store or something? We need to start thinking in terms of, at least in the big cities where people have access to these forms of technology, how we can go beyond the current difficulties and bottlenecks that we face with working with governments and getting approval from educational systems to reaching young people, because whether we like it or not, this is information that is critically needed, and we cannot continue to delay. So this, I'm afraid to use the same overused terminology, but I think here we need to think outside the box and look at what else we can do to reach young people with the services and information that they absolutely need in a very critical way.
Samuel, thank you so much, and Felogene as well, for just those key insights into what more can be done to specifically improve adolescent health and children's health. I think all of these interventions are key and critical. It's not just, like you said, Samuel, it's not just a one issue thing. It's many different issues, and Felogene, as you said, many different issues, violence against women, all of these different things that go hand in hand when we're talking about health for women and children and adolescents. I think we have a question from the audience, so I'm going to hand it over to Elizabeth to hear from the audience.
Thanks, Diane. And I just wanted to put a reminder out there to everyone to join the conversation on Twitter using the hashtag commit with the number 2 deliver. So commit to deliver. We're having a bit of a conversation on Twitter right now. So I'm going to start off with this one question. It's from @RosebudMidwife, and she asks, if you could improve one area of services across the board for young mothers, what would that be? So what's the most important factor to improve services, if that makes sense?
Maybe if we want to go to Felogene first.
Wow, I'm not sure if there's one factor that can really be the magic wand that makes everything perfect for young mothers. But I think for me, information is power, really. So that if people are able to access information to the services, to their rights, to the healthcare facilities, I think that's the one thing I would actually focus a lot of energy on in terms of access to information. Yes, that's it.
Samuel, do you want to add on? Do you have anything to add on to that?
Yes, well, this is a very difficult one, and I'm torn between one, the bit about expanding access, which includes then removing all kinds of barriers to women's access to these services, which includes financial, but also all these socio-cultural barriers that have been put in place in so many places. But we also know that in many places, the main issue is even having access to a health facility and to health personnel. So I would say investing heavily in the systems, in the healthcare systems, and this will include systems that are nimble to respond to the different needs of women in different settings.
Great, thank you. Such a key question for this conversation. So thank you so much for those wonderful answers. Elizabeth, do we have anything more from the audience at this time, or?
Sorry, not as of right now, but we are still waiting on questions, and encourage you to submit your own so that we can. We really want to engage the audience and have you guys ask questions. So please feel free. You just remember to use the hashtag #CommitToDeliver, and we'll be sure to ask your question to the wonderful Sammy and Philogene.
Great. I want to continue our discussion today and move back towards talking more about the Global Financing Facility. As you all have already stated, some great interventions that you would like to see financed, both within the health sector and outside of the health sector. But I'm wondering, as you're thinking about this concept of pushing for more financing for maternal and child and adolescent health, do you have any concerns? What are your concerns, and specifically in the realm of supporting this type of initiative supporting youth, and how do you think those concerns can be addressed? Samuel, we can go to you first.
Yeah, well, first of all, I think it's important to state that I think it's a very important and timely initiative to have the Global Financing Facility. In terms of concerns, it would mostly be hopes of things to avoid, and one of the things I hope we avoid is falling into the same traps that previous such efforts of trying to finance these initiatives have experienced. And I think when I hear something like the GFF, the first thing I'm thinking about is sustainability and ensuring that there is a commitment for the long haul in ensuring the availability of funds at country level to make sure we are able to prioritize issues concerning women, children, adolescents, newborns. Next, I think there is the need to also focus on evidence, looking at what has worked, what will work, and how we can bring those to scale. Of course, bearing in mind the different contexts around the world, but we really need to be evidence-based. We need to really focus on looking at what has worked. The terminology best practices gets used a lot, and I don't know if there is ever a measure to know what is best in the world, but we need to have an agreement on what works and how that can be brought to scale, because we are having too many instances where different governments, different institutions have some pockets of good examples, but these are not brought to scale to have a meaningful impact on the larger population. So for me, that is extremely important. And we need to look also a little beyond just state institutions to look at how we can work with civil society to ensure that we reach those that critically need to be reached in this process. So in terms of concerns, those would be it. I think we need to focus on the issue of sustainability. We need to look at scaling up what works, and we need to look at how we can involve civil society, particularly young women and youth organizations and young people.
Thank you, Samuel. Speaking about what works, in your experience with Curious Minds and really advocating for youth, have you seen specific things over the past several years that have worked to support youth in the realm of adolescent health?
Well, there are a number of things. some of our viewers may have heard about the KAMA, which is the campaign for the accelerated reduction of maternal mortality in Africa, which was just in recognition, for instance, of the high maternal mortality rates in Africa. Now, as young people, we decided that there is a role that we can play here, even without any resources. And what we did was to establish strong partnerships with other youth organizations, go into communities, and just raise awareness about things that misconceptions that people have, for instance, based in culture and religion and just ignorance of things that they can do to, for instance, just ensure that women, when they were due for childbirth, got to the health facility in time. There were just simple things like in some communities in Ghana where the taxi drivers would not take a woman who was due for labor in their car because they think it is an abomination for the woman to break water in their car or things like that. And these were things that we saw as young people that we could do, help change people's mindset and educate them, sensitize them on these issues without needing so much money. And this is something that we started, and we're to a large extent making a lot of headway. I think that young people have a lot of leverage that is often underestimated. And I was really happy Fellow Jane brought up the issue of even literacy. Now, if you go into these different communities, who are the people who the highest in terms of the rate of education is the young people, and they then are a vehicle through which we can reach communities, reach people within the communities. So what we did in Curious Minds was to go into these communities, work with different youth organizations, and look at what we can do to raise awareness within the various communities so that we can reduce the higher rates of maternal mortality. This is just one example. There's, for instance, work that we're doing using our radio platforms to reach policymakers and draw their attention to various aspects of the response that has not received enough attention, but also even sometimes to certain communities where things have to change drastically. We know that with our advocacy and with the sensitization that we do as young people, we can help in bringing change in many places. So I think that there are so many examples, and this is not unique to Curious Minds. Even within the network of AFRIAN across the continent, we know that there are many organizations who are working on different aspects, including providing comprehensive sexuality education in schools and out of school, using theater and dance and different things. So young people are already making a contribution. There is a lot of evidence to show that many of the interventions we have used work, but often the financing, the funding of these initiatives is very difficult, and you have to compete with many other organizations, and it's generally very difficult for youth organizations. But I think that we need to look at how we can harness the comparative advantage that young people bring to the table and make sure we use their abilities to reach those who we have been unable to reach so far.
Wow, Samuel, that's just such a powerful example and testimony, really, of what young people can do even with limited resources. And as we're talking about resources, how much more you have the ability to do with greater resources and with greater support from the broader international community at large. Fellow Jean, if you want to just, I'd love to hear your perspective. Any concerns that you have in regards to supporting youth and how those concerns can be addressed? And if you also want to share as well things that you have seen have worked in regards to supporting youth in your initiatives.
Okay, so I think Sami has said quite a bit, but the only thing I'd like to add is that my only concern, perhaps which has a solution, thankfully, is that we don't go back to the pitfall of imagining that young people are a homogeneous group and women are a homogeneous group. Because if we go back to that pitfall, that means we'll always have a one approach to how we want to deal with these issues. We need to recognize that, that there are different kinds of youth. There are young people with disabilities, there are the sexual minorities, there are the unemployed, there are the grassroots, there are the rural. And if you're able to do that, it will inform meaningful engagement of how we will consult them in this process, and especially now that the GFF is doing the consultation. So we need to also be very mindful of how we engage young people and also women, so that we can say that they actually participated in the consultation process. So that's actually one of my concerns, and I believe that that's something that can be addressed very easily. Secondly, as Samuel Kisi had said, was the issue of rights, having a rights-based approach. In Africa, we are currently having a very huge challenge. We're having a setback and a rollback of rights, especially when it comes to sexual and reproductive health. And I believe that this is a conversation that we need to have, especially because we have the highest maternal mortality rates across the world, and we know the reason for this. And if we're able to change our perspective and our approach to giving the solutions for Africa, which is a rights-based perspective, is when we'll have things business unusual and things moving on very differently. So those are some of my concerns, and I believe that on the issue of rights, like I said previously, is the issue of literacy. That literacy is very key in understanding what rights are, and especially educating them in some of the protocols and the conventions that are already there and accord these rights for the women and the girls across the world. So those are just my two concerns in terms of the approach. And I believe there's something that can be done about it, thankfully. In terms of successes of young people, one, I believe that young people have a lot of energy, have a lot of talent that is untapped, especially when it comes to health issues. For example, is the issue of technology. In my country, I know the young people are very busy working on mobile apps. There's one called mHealth that helps people track some of the cases. For example, if there's been a birth or if there's a pregnancy, and just to map out the radius to the nearest hospital. So this is helping inform policymakers' decisions on the population that is actually able to access health services. So in terms of empowering them and financing the technology aspect, this is something that young people are doing so well across the continent. And if this is leveraged, it can have a higher impact in terms of the health outcome and indicators. Secondly is the issue of internet and our social media revolution. We have been able to see that young people are able to drive very many campaigns and have resulted in very many declarations that have been as a result of their mobilization on social media, because they are very active in this phase. For example, in Kenya, the President Uhuru Kenyatta had a decree on free maternal health care for the women and girls in Kenya. But we can largely say that this was driven by the youth movement, because they were able to voice out the issues. They're able to record videos of, the kind of poor services that are at a local level. I remember on one video, which was really so sad, was a health service provider actually beating a woman who was on labor, and the woman ended up giving birth on the floor of the hospital. So I can remember in the background they were really taunting her and telling her that so many women have given birth. You don't have to cry about it. You don't have to scream and shout. And she ended up giving birth at the floor of the hospital. And this was viewed across the country. And it's such things, such small pockets of action that we have from the youth that are able to drive huge awareness on the issue and eventually some action on the issue. So I think investment in young people, especially the technology aspect, but also because they are aware of the issues that are happening and the injustices that are happening. So investing in young people and partnering with them in a very meaningful way will be able to deliver the results and have business as usual and have the kind of impact that GFF is hoping to do. And as Samuel Kisi not as the usual other financing facilities and also the other funds and agreements, but something different and something that will have a lasting impact and legacy. Yeah.
Jean, thank you so much for your comments. I love just what you said about really we need to really ensure that youth voices are included, which is what we're doing here today. And the conversation is really going strong on social media. And so there are several questions that that people want to ask you from our social media audience. So I'm going to go ahead and turn it back over to Elizabeth to ask you all some questions from the audience.
Thanks, Diane. And yeah, it's been a really great conversation so far. I've really enjoyed listening to our two panelists, and I've also had an eye on Twitter and social media outlets, so that's why I'm kind of looking off in the distance sometimes. I don't want you to feel like I'm not paying attention. So one of the questions that we have from Google Plus is from Carl Johnson, and he asks, how can we work for women's rights in extremely patriarchal societies? And how do you provide education to women about their own rights if there are males deciding if the women are allowed to take part in education or not?
Maybe we want to direct that question towards Samuel first, if you want to go ahead.
Yeah, definitely. Thank you very much. This is an extremely important question, one that many of us have been grappling with for some time. And I am happy to note that there is a growing consensus, even among civil society and with governments, from what we are seeing, that we need to bring men on board and address that health when we're talking about issues like violence against women and all the denial of rights of women. The main perpetrators are men. Just a few weeks ago, about 3 weeks ago, there was a global symposium of men engaged in New Delhi, which was very telling because you may remember the story from New Delhi about the rape and all of that. And I think this is a recognition that we need to engage men in a meaningful way. Men need to come to the table and assume responsibility for all the things that we have contributed to making wrong, but also helping mainly with education and sensitization in many places across the world, especially in the developing world. It has been my experience that men have been at the forefront of perpetrating these violence and discrimination against women, sometimes because just because of the culture, they feel that is the right thing to do. And in some places, they do not even know that what they are doing constitutes an abuse. And I think it's important that we start that discussion in terms of involving men when we talk about women's empowerment and ensuring that women are able to enjoy their rights, particularly when it comes to decision making in the home, when it comes to allowing or getting out of the way of women when it comes to decisions that women have to make regarding their own bodies. In my own country, I was shocked when in the last census some women could not be counted because in the part of the country where they were, their husbands were not at home when the census officials got there, and they had not given permission for their women to be counted. And I think it is sickening and frustrating that even in this century we have challenges like that, but it is not unique to Ghana, and it's definitely not unique to Africa. This is a challenge that needs all of us coming on board. You will see that in many places it is men who have, to a large extent, poorer education and less sensitization, who are the most violent perpetrators of such discrimination and abuse. And I think we need to find ways of engaging with them. In some places there are clubs, groups where they're able to speak to these men and try to help them change their attitudes. But I think we need to do two key things. In Africa, we say that it is easier to bend a tree when it is young. So we need to focus on the younger generation in terms of helping them to understand that there is no difference in abilities between a boy and a girl, that they are both equally able, and they all should be given the same opportunities. Then, for those who are already big trees, who might be a little harder to bend, we need to ensure that there is a lot of sensitization, but also we need to reduce the impunity that we see in many countries when it comes to violence against women, for instance. In so many places, men abuse women and get away with it. Even if there are laws, the laws are not enforced. and in so many places there are no laws that will put such people to book. So I think we need to do a range of things. We need to do the bit of sensitization and changing attitudes, but we also need to put in place laws and policies that can help us to arrest the most extreme cases that we face right now in many parts of the world. It is not a very simple issue, and obviously I think there are so many things that we need to do, but part of that is recognizing that this is an important thing to do, and that we can actually engage men and hope that we will change some of these systems that have been entrenched for generations that are depriving women of their rights.
Thank you so much, Samuel. Because of time, I think we're going to move to another question from the audience. But fellow Jean, if you want to also comment on that question, you can in just a few minutes.
Okay, so I think Samuel has said it all, but what I'd like to add is that it is possible to actually talk about women's rights in a patriarchal society. And I like what Desmond Tutu said when he was speaking on child marriage. He said that if it wasn't for us men, if men did not exist, there would be no violence against women. Because why? Men are the perpetrators of violence. Men are the policy makers. Men are the ones who watch while this violence happens. So I think essentially we have been preaching to the choir for the very longest time. We have been telling women about violence against women, yet they do not actually do the violence on themselves. It's actually men who perpetrate the violence towards women. So I think at Femnet we're also doing a lot of work on that, and we have a lot of lessons learned, not only with by engaging men, but also engaging religious and cultural leaders who are the custodians of this patriarchal society. So some of the lessons we've learned is that it needs to be a conversation. It needs not to be imposed on them, because like for the lesson we learned with female genital mutilation was that it was a right of culture, and you cannot remove culture and leave a vacuum. So for them, they needed alternative rites of passage, which we had, we had the conversation and we said, yes, you can have alternative rites of passage that do not necessarily infringe upon the human rights of another human being. So for us, it's really been a conversation and not really imposing those rights, but trying to understand where these cultures come from, and what actually perpetrates them, and if you can replace them with something that does not infringe upon the human rights of people. But yes, it is possible.
Okay, thanks, fellow Jean. That was really an incredible answer. I just want to move it over to one last question from the audience, and this is from Julia Wicklander. And she says, I'm glad to see youth are being invited to participate in the discussions surrounding reproductive, maternal, newborn, and child health. But how do we ensure their leadership? So, Phalo Jean, since you just went, I'll hand this over to Sammy.
Well, so leadership of young people, including of young adolescents, I think it's extremely important. And it's an issue that has been discussed quite extensively, even in discussions around youth participation. I think that we need to start putting our money where our mouth is, and that includes making the investment in building capacity of young people. First, we need to acknowledge that they have a crucial role to play, and we should not just engage young people and support them on a superficial level. We need to work with young people to find out how we can support them in the most meaningful way, providing that capacity building or strengthening their capacity in ways where they can be effective in these spaces. In spaces, for instance, around consultation like we're having now around the Global Financing Facility. Now, I find so often that it is easy for governments, development partners to say, yes, youth leadership is important, but nobody wants to do the hard work of making the investment. And I think that is where we are lacking. So if you ask me today in 2014, one action that we need to take to really ensure youth leadership, I would say invest in young people and give them the means so that they can show their leadership. So invest in them and get out of the way. and let's see what young people can do in bringing a change.
Sammy, so exciting. Thank you for just that powerful response. Fellow Jean, I'll hand it over to you to answer the same question.
Okay, so I like that Sammy talks from a perspective of investing in the youth. For me, I'd like to respond by having a rallying call for the youth. And in Africa, we say leadership is not given, it's taken. And I think you can see that from what happens across the continent. We as young people have to invest in ourselves in terms of getting the information about what's happening globally, how 2015 is going to be the turning point for very many things, the post-2015 development agenda, the GFF, the Beijing +20, the numerous opportunities that are going to happen in 2015. We must be in touch with all these opportunities and then empower ourselves with information. So that if you get an opportunity to speak to a policymakers about issues, let them see the leadership coming from the young people. Let them not source for young people so that they can give them leadership. I'd like to say that leadership is taken and it's not given. Thank you.
Well, thank you so much, both of you. I think that question was a great one to wrap up this engaging discussion. I really appreciate both of you for just taking time to be representatives for youth everywhere, for giving input on the things that you're doing in regards to empowering young people and adolescents to improve maternal, child, and adolescent health. I appreciate your insights on the Global Financing Facility. All of this information and communication will be curated and actually put into a synthesis report that will be released on December 15th. So know that your voice is being heard. And like you said, Sammy, a key thing, and fellow Jean as well, is really investing in youth, not just having these conversations, but really shifting the conversation to where youth can really have a part in affecting change from a global level all the way down to a grassroots level. I know at Girls Globe we believe that youth voices matter, and you all really are the ones creating change, and you have an amazing ability to create change, and specifically for maternal, child, and adolescent health. So I just want to thank you both for what you're doing to advocate, to create change, sometimes with limited resources. Both of you are doing amazing work, and I'm just inspired by our conversation today. For those watching, you can continue to participate in this conversation. First of all, you can follow Girls Globe and participate that way, but you can also continue to use the hashtag commit with the number 2, deliver, as well as visiting the website womenandchildrenpost2015.org. This has all the information that you'll need on these particular topics, and you continue to engage via that platform as well. This Google Hangout will be shared through there as well. So I want to encourage everyone listening to really participate, continue in this conversation as we really bring youth voices at the center. So thank you so much, fellow Jean and Sammy, for participating today.
Thank you for having us.
Thank you.
Thank you so much.
Thank you so much.
It still says live. What do I do?
I'm also wondering, do we hang up?
Okay. It was nice seeing you, fellow Jean.
Nice to meet. I'm sure we'll meet soon and talk soon.
All right. Bye-bye.
Bye-bye.